Quite often what I see with working with patients, estrogen isn't so much the problem, it's really progesterone. It's not so much estrogen dominance, it's typically a progesterone deficiency in relation to estrogen that's causing all the problems. Natural progesterone doesn't cause breast cancer or breast tissue proliferation. It actually balances out estrogen, where synthetic progestins can actually do that. When you buy an over-the-counter progesterone cream, which I'm not against those, but I will say you just really don't know what you're getting because there is no regulation. If your levels are low and you struggle with sleep and your doctor won't at least consider or talking about progesterone, that's a problem. Welcome to The Trusted Pharmacist, where you'll learn the truth about how the body works. Welcome back to The Trusted Pharmacist. I'm your host, Steve Hoffart. If you're a woman that struggles with hormone issues, PCOS, menopause, perimenopause, irregular cycles, you name it, if your hormones have been out of balance, I can almost guarantee you the hormone that's typically the problem is progesterone. And as a pharmacist that's trained and been doing hormones for 20 plus years, I see progesterone as the one hormone that most even quote unquote hormone experts don't get right. So today we're going to take a deep dive into progesterone and how it can be used to help improve your overall health, how it can be used to help get the benefits from, and what you need to understand how synthetic progestins, which are not progesterone, can really wreck your health. So as we jump in, even if you're a male, you're going to want to listen to this because I'm sure you know a female that struggles with hormone issues. There's even a little tidbit how sometimes a little bit of progesterone can help men during hormone replacement. And another big controversy about progesterone and especially synthetic progestins is how safe they are. And the last thing is that's important to understand is that all of these hormones, if not done right, can actually cause problems. So let's start with a little simple overview of progesterone. Estrogen and progesterone play in the same sandbox. And I'll be honest with you, it's all about the balance of these two hormones that keep hormone cycles normal. Your body, through natural cycling as a female, has to produce a certain amount of estrogen in the right level and a certain amount of progesterone in the right level to help achieve pregnancy. And when these get out of balance, this leads to many of the cycle issues. And we see this in women, young ages of puberty, up through pre-adolescence, even in perimenopause, that's when the cycle begins to get out of balance. And then into menopause, where one of the biggest issues is we really just don't make progesterone like we used to if we're a female. And trust me, hormones are complicated, but let's keep it a little simple. If you look at estrogen as the part of the body in the hormone cycle that makes the noise, it's the progesterone that brings the calming effect or brings the noise down. Another way to look at it is, if estrogen is what makes your grass grow, get taller, get big and fluffy, then it's the progesterone that's the landscaper that actually helps bring it down and keeps it in check. And that's why these two hormones play in such a delicate balance. And quite often what I see with working with patients, estrogen isn't so much the problem, it's really progesterone. And even in things like estrogen dominance, what I see is it's not so much estrogen dominance, it's typically a progesterone deficiency in relation to estrogen that's causing all the problems. And what do low progesterone issues look like? So in a younger female during cycles, it's irregular periods with PMS, a lot of issues with bloating, irritability. But as we get older, when these get out of balance in terms of estrogen and progesterone and your progesterone's low, you have breast tenderness, you have irritability, mood swings, foggy thinking. You can have issues where you have weight gain, low libido, low sex drive, insomnia, migraines, and even things like fertility issues become a problem because without progesterone, it's virtually impossible to get pregnant. So before we can take a deeper dive into progesterone, you got to kind of understand what it does. So progesterone is produced by the ovaries during your normal cycle years. But as you get older, the production of your progesterone goes from being made from your ovaries to pretty much only being made by your adrenals. And believe it or not, the body actually makes a little bit of progesterone in the brain. But what's important to keep in mind is when the ovaries stop making progesterone and your adrenals have to pick up the slack, if you're in poor adrenal health, you've had years and years of bad stress, unfortunately, it makes that transition period even worse and more challenging. So as we talked about already, the main role of progesterone is to keep estrogen in check. And those two together are critical to help keep a healthy, happy hormone cycle. But other big roles that progesterone plays, and one of the most important, is in the brain. Progesterone is neuroactive. It actually works in the brain to calm it, potentiates GABA, your calming neurotransmitter, and it actually has some of the metabolites that work in the brain to help calm, relax, and give you a sense of overall less anxiety. Without progesterone, you can't get pregnant and you can't maintain a pregnancy. Progesterone actually helps produce better bones. It helps modulate the immune system. It improves gut health, controls bladder function, stabilizes mood, and actually has a protective effect in terms of preventing breast cancer. And one of the unique things about progesterone is that it actually has a diuretic effect because its effect on other parts of receptors in the body. So that's why a lot of times when our estrogen and progesterone gets out of balance with low progesterone, we notice a lot of fluid retention and swelling. Progesterone is produced during those reproductive years. It's part of the second part of your cycle, the luteal phase, where progesterone rises. And this is all to allow you to either get pregnant or maintain a pregnancy. So what happens is you ovulate, and after ovulation, if that egg gets fertilized, then it implants into the uterus, and progesterone is there to grow that uterus, to protect that newly seeded fetus into the uterus and protect it. And then this progesterone levels begin to take off and grow. But if you don't have implantation or pregnancy of an ovulation, progesterone levels drop, and that starts your next cycle. But let's talk about this. That's during normal cycles. But then as we age perimenopause, about 35, our progesterone levels will begin to fall. So what happens is progesterone begins to gradually fall, and estrogen typically stays pretty consistent, but it will begin to bounce and go up and down in late 30s and 40s and into 50 when menopause starts to happen. And that's when all these unusual symptoms start to happen with perimenopause and menopause, a disimbalance of estrogen and progesterone. And when you get to menopause, pretty much progesterone production almost stops, and the only little bit you make is actually by your adrenal glands. So what are some of the things that actually can cause lower progesterone levels? So first of all, it's just natural aging. It happens. I get asked that all the time is, do I have to supplement with progesterone? And unfortunately, with most females, just part of aging, your levels are going to fall just because natural production falls. The other thing is you can have an issue with LH. If your LH is off, it can also affect progesterone production. If you've been on birth control pills, that can have an effect. Being low in certain vitamins and minerals and poor protein in your diet can affect how well your body makes sex hormones. One of the big issues that I see for low progesterone issues that are unrelated to age is high stress. When your body's under a lot of stress, it makes cortisol and doesn't make as much progesterone. And a couple other common causes are things like antidepressants, having issues in terms of having low thyroid function, and high prolactin levels all can cause problems with progesterone production. So let's talk about one of the biggest things that I struggle with as a pharmacist who's trained in hormones to make not only patients understand, but practitioners understand. And that's the difference between bioidentical natural progesterone and synthetic progestins. Keep in mind, synthetic progestins were developed to be used mostly as birth control pills or the protective effect that you need when you give somebody estrogen. Remember how we talked about estrogen and progesterone balance each other? And if you give somebody estrogen, but you don't give them progesterone or a progestin, you can end up with the uterine lining growing too much and ended up with problems. But the problem is when you give synthetic progestins, these do not work in the body like progesterone. First and foremost, they bind other receptors other than progesterone, and this can cause some of the problems with the side effects. They block your natural progesterone, so it cannot work as well, and that's another issue. And if you look at the chemical structures, they're very similar, but our bodies are super smart, and our receptors are very, very sensitive. So when you give synthetic progestins to someone who really needs natural progesterone, you can see some problems happening. And to be honest with you, this is the whole problem why women and hormones have been stopped up to now because of the Women's Health Initiative study in 2002. It was the synthetic progestins that was in that study that showed all these breast cancer risks that sent the world and healthcare providers into a fury that shut down hormones for all of these years. And those synthetic progestins can actually increase the risk of breast cancer, where natural hormones done right with true progesterone actually reduces those risks. Because natural progesterone doesn't cause breast cancer or breast tissue proliferation. It actually balances out estrogen, where synthetic progestins can actually do that. So if you're taking something that doesn't actually say progesterone, it may have words like mejoxyprogesterone, levonorgestrel, or norethindrone. Those terms are actually synthetic progestins and are not progesterone. And like you said, other than protecting that endometrial lining, they don't have really any of the true value that progesterone has. And because these synthetic progestins set on the progesterone receptors and even other receptors like the androgen receptor, or they actually don't work on what's called a mineralocorticoid receptor, we see side effects with synthetic progestins outside of this breast cancer risk. Those are things like fluid retention and swelling, increased appetite, things like acne or oily skin. They actually block your progesterone from working, and they also negate some of the benefits that you get if you're taking natural estrogen. So what are your replacement options for natural progesterone? There are a couple commercially available products on the market called Prometrium. It's progesterone micronized. That's progesterone that's in a peanut oil-filled capsule. It comes in 2 strengths. And if those 2 strengths work for you and what you personally need for your body, and you don't have a problem with peanut oil, these may be good choices. But as a compounding pharmacist, we've been recommending and using progesterone compounded for years. And there's a lot of options. First and foremost, probably most popular are progesterone capsules in an ultra-microfined progesterone size that allows for better oral absorption. Progesterone doesn't get absorbed very well from the gut, and by making a smaller particle size of progesterone, we can actually help allow a capsule of the progesterone to get in your system. Now, one of the unique things about doing progesterone as a capsule, it goes through what's called first-pass metabolism. It goes to the liver. But what's unique about that is some of these metabolites of oral progesterone are those neuroactive peptides, which in the brain reduce anxiety and actually help potentiate the GABA receptor that creates that calming anti-anxiety effect. And this happens more with the oral form than doing, say, a cream that gets applied topically because you don't have so much of those metabolites that are formed. There is some anecdotal data that I've heard in several of the lectures that maybe doing the oral progesterone capsule may be the most beneficial for ladies who are 45 and older because of different cancer preventions and overall cardiovascular risk protection. So keep in mind, one of the other key things is remember, if you're on estrogen and you still have a uterus and you need progesterone, really only the data is out there to show that oral progesterone provides that benefit, where topical cream progesterone may not provide it as well. Not saying that topical cream progesterone doesn't protect the uterine lining, but I do want to say there's just not as much studies and data to support that. I get that question a lot from providers. But some ladies just don't tolerate oral progesterone too well. Sometimes maybe they're not given enough, or they're super sensitive, or they're given too much, which that's the neat thing about compounding is we can make any dose of progesterone that's needed, but sometimes doctors then will use a progesterone cream. Here's the problem I see quite often. A lot of times they'll give the same dose of topical progesterone cream as they give in an oral capsule. And here's the problem with that. Remember how we talked about progesterone gets broken down in the gut and then in the liver, and you don't get as much absorbed because of that effect. When we go to put on topical progesterone, we typically need lower doses, not equivalent doses to oral, because it gets in the system better, especially with the bases and stuff that we use to help improve the topical absorption. So typically what we see is usually about 1/5 of the dose topical equivalent to that oral dose. Other delivery ways are progesterone suppositories. We've been seeing these for years for women to maintain pregnancy. One of the biggest issues that happens with ladies who get pregnant and have a miscarriage is they don't make enough progesterone to maintain that uterine lining and protect that newly developing embryo. So what happens is many doctors for years have given vaginal progesterone to help boost those levels and the uterus to make sure the pregnancy stays viable and healthy. So that's another way that progesterone can be replaced. And a lot of times I get questions, hey, I've got these yam creams or these progesterone creams that are over the counter. Just a word of warning. First, if a product contains like yam, it isn't really truly progesterone. Yes, a lot of the synthetic progesterone that's made that we compound with is bioidentical. It's exactly what your body makes. It started out from yam, but it's chemically changed in a lab to make it be exactly what the progesterone is that matches your body. So i.e., if we compound it, the progesterone in our lab is bioidentical, exactly like what your body makes. Now, when you buy an over-the-counter progesterone cream, which I'm not against those, but I will say you just really don't know what you're getting because there is no regulation. And then even worse, a lot of these products just come as a tub full of progesterone cream. This is a hormone that has therapeutic effects in the body. And if you're just slapping on a random amount of progesterone cream thinking you're going to get the benefit, you don't know how much you're putting on, what the quality of the product is, what else is in there. So I am all for making sure you get a quality compounded progesterone if that's what your body needs, because it can be customized, but more importantly, it's quality and you know exactly what you're getting. So let's knock out some of the big progesterone myths that I hear all the time, and let's get these out in the open. Let's get the truth about really what progesterone does, and let's tackle that. First is synthetic progestins versus progesterone when it comes to breast cancer. There are plenty of data out there. There's no debate on this, that synthetic progestins can increase the risk of breast cancer. That's been known for years. Where natural progesterone protects that breast tissue, balances out the estrogen effects, and has not been shown to do that. So that one's plain and simple right off the bat about natural progesterone is your way to go there, especially in terms of breast cancer and you're not wanting to increase your risks. Next, when it comes to cardiovascular risk, we know that synthetic progestins, once again, can produce bad cholesterol numbers, negate the beneficial effects of estrogen, cause weight gain and mood issues, and all those things have been linked to higher cardiovascular risk, where progesterone, once again, doesn't have those risks. There's a little bit of data to show that it actually may have some beneficial effects in terms of the heart, but at least it doesn't raise the risk like synthetic progestins do. And finally, whether it be oral contraceptives or even IUDs that have synthetic progestins, there's actually a study that shows there is an increased risk of 20 to 30% of breast cancer with these oral contraceptive products. And the big issue that I have is people need to be informed and educated about this. I know many people either A, go to their doctor, or B, go to their pharmacy, and they're never told about these risks. These are the type of things that you need to be told about and you need to understand before you start these medications, because it is all about risk and benefit. And if you don't know this to start with, you may make a poor choice or run into a health issue down the road that you really didn't realize you were even putting yourself at risk at. Let's talk about stress and progesterone. And what I've learned through the years is if there's any one thing that can really mess up somebody's progesterone levels, even less or even more so in terms, I would say, versus aging, it is stress and cortisol. When you have high cortisol, you actually steal away the building block, which is called pregnenolone, from your body making progesterone. So it's not uncommon for ladies who are under massive amounts of stress with high cortisol to have lower progesterone levels. And we've already talked about the benefits of progesterone, and we don't need to be running low in progesterone. But even worse, when you're under a lot of stress and you have a lot of what's called sympathetic tone, you produce a lot of neurotransmitters like adrenaline. These actually downregulate progesterone receptors, which means what progesterone you make can't work as well. So you're really butting heads against yourself if you're trying to help increase your progesterone levels, but you don't address cortisol. And even worse, if we naturally replace progesterone, especially in a cream form, and you're under a lot of stress, your body doesn't keep much of that progesterone in the system as progesterone. It then wants to convert that over to cortisol, which you can do. So sometimes, even though you think you're taking progesterone to calm and relax your body, you can be driving up more cortisol, and this can just cause more problems. And lastly, if you're a female struggling with progesterone issues, especially being low, and that's driving your anxiety and poor sleep, oral progesterone is your way to go. So if your levels are low and you struggle with sleep, and your doctor won't at least consider or talking about progesterone, that's a problem, because progesterone being low can definitely drive that. Now, what's important to know is where you're at. If you're still cycling, sometimes we'll look at what's called cyclic progesterone, where we use certain levels at different times of the month to match what the body's doing. But once we get, and we're in the menopause years that we're not cycling, most of the time progesterone is given every day. Now, I do recommend taking a progesterone or actually a hormone holiday several times a month, just so that we give our body a break, because even during normal cycles, your body didn't make progesterone the same amount every day. And this hormone holiday kind of mimics that. And this is one I get all the time. I don't have a uterus. Do I really need progesterone? And that answer is emphatically yes. Yes, when you're on estrogen and you have a uterus, you need progesterone to balance it out. We talked about that. If you look as estrogen is the fertilizer and water for your lawn, it is that progesterone that is the gardener or that is the lawnmower that keeps it cut. But just because through surgery, your doctor took out your uterus and you no longer have it, you still have progesterone receptors on every tissue in your body. And we've already talked about how progesterone in the brain is neuroactive. It has a calming effect. But then also progesterone has the ability to have other benefits in terms of metabolism, cardiovascular effects, the effects on your bone. So for somebody to say that you don't need progesterone because you don't have a uterus, they're not really following what the science shows today. And one last thing, can you get too much progesterone? And that answer is yes. And let's just go back and look at the body during pregnancy. During pregnancy, you make the highest amount of progesterone that you're ever going to make. And we know many ladies have to get checked for something called gestational diabetes because these high progesterone levels set the body up for reduced insulin sensitivity, which means your body has to make more and more insulin. And we see diabetes happen a lot during pregnancy. Well, the reason that is because the body is trying to make sure there's plenty of glucose there for the fetus, which is a good thing during pregnancy because we're trying to protect the child. But as we get older, if we give progesterone and we give more than we need, this exact same phenomenon happens. It reduces insulin sensitivity, insulin levels go up, weight gain can go up, and then we can run ourselves into a pre-diabetic position just by giving a beneficial hormone like progesterone. So it's important that your level that we monitor the levels, check those and make sure that they're monitored and keep in what's called a normal range versus an excessive range. And I see this happen a lot. Because a lot of ladies are like, well, I tried to take progesterone and I had bloating or I ended up having weight gain or I ended up having problems with other stuff. And that's probably because they're dosed too high or given too much too quickly. And that can drive all of these problems because too much progesterone can be an issue too. So if you're on progesterone, signs that maybe you're given too much is a lot of bloating, a lot of GI upset, increased blood sugar levels, problems with mood, weight gain, cramping, and even mood issues can be indications that the progesterone you're on could be too much. And you may actually need to back the dose down. So remember, don't let the confusion of the World Health Initiative study that used synthetic progestins that said they increase risk of breast cancer, that took away hormones from women for years, cause confusion about progesterone. Compounding pharmacies like myself have been making progesterone for years, and I see the true benefit because it matches with what the body needs. It's bioidentical. We can balance it out with estrogen to get all of those benefits that can happen to you when your hormones go level during menopause. And most importantly, compounding allows for customizing of this progesterone dose to exactly what you need because every lady needs a different level based upon genetics, diet, lifestyle, and so many other factors. And just a tidbit for you men out there. Quite commonly when we do hormone replacement in men, we will look at progesterone levels because if those are non-existent, we can run into problems. Yeah, we don't have to balance out estrogen with the uterus, but low progesterone can affect sleep. It can affect your bones. It can also affect your ability and mood issues. And it's even been shown to be beneficial in terms of possibly prostate health. Once again, more to come, but I've quite commonly seen doctors who have men who have no progesterone levels at all give some low dose progesterone and see benefit with that along with their testosterone therapy. So I hope by now you see progesterone is just not the hormone that protects the uterus. It does so many other things. It is part of the hormone symphony that keeps your body healthy and happy, not only in your younger years, but your older years. It's such a key hormone to find the right amounts during perimenopause and especially at menopause, because without proper progesterone levels, there's just so many bad health consequences that end up on the other side. Remember, synthetic progestins are not progesterone, and the way you dose it, the way you give it, the proper dose, and the way you monitor and test are so critical for your overall health outcomes. But if you're not looking at progesterone levels and replacing it properly, you're missing a big part of the boat that has your protection in terms of helping you get older. So if you know anybody in those menopausal years with the breast tenderness, the bloating, the weight gain, the irritability, poor mood, and poor sleep, you're probably going to want to share this podcast. And if you found it helpful, be sure that you like it yourself so that more people can find the podcast. And once again, thanks for joining me on The Trusted Pharmacist. And I hope you found that this episode about progesterone can make a difference in your life.